Hello, everyone, and welcome. We are so excited to be here today to present our final defense, Immersive Virtual Reality in Healthcare, a Systematic Mapping Review. The following presentation was developed by Julia Gomez, Joshua Oliver, Veronica Pabich, Jamie Schaefer, and Melissa Tonkovic. At this time, I encourage you to expand to full screen so you can immerse yourself in this experience. Pun intended. And please hold all of your questions until the end when we can have time to review them. First off, we want to thank our committee members, Dr. Truskowski, Betsy Williams, and Hunter Bridwell. Thank you for attending our defense and assisting us with this research process. Here is a quick overview of our defense. First, we'll give you an introduction and then move into a background and literature review section. Then we'll provide our methods, results, discussions, and we'll move into limitations and implications for occupational therapy, and then we'll conclude.
Next, we are going to introduce you to what exactly we have been working on all semester long. Purpose. The purpose of this mapping review was to identify the available evidence-based research regarding the utilization of immersive virtual reality with distinct diagnostic groups across various practice settings. The research process identified current evidence and gaps within literature. Rationale. So basically, why did we do this and why is it important? With the development of new cost-effective systems, the use of VR has recently exploded into fields such as gaming, archaeology, and the visual arts. Some of its most promising applications are developing in the healthcare sector. In order to have a better understanding of future applications of virtual reality, specifically interventions within the field of occupational therapy, we knew it would be very important to have an understanding of how VR is currently being used.
Here we have a quote from Lauren Sheehan that we felt encompassed how technology and occupation intersect. She says, "Technology is not only a means for occupation, including how we work and relate to each other, but is also the target of our occupation now more than ever before. As a human race, technology consumes a great deal of our occupational behavior. Why? We are engaged, connected, and rewarded through technology."
Let's quickly review the existing literature and some of the challenges we identified, as well as some of the definitions that are related to our research. So, in the early stages of our research process, some of the existing literature allowed us to see the growth in technology over the years. The expensive equipment, heavy head-mounted displays, pixelated cartoon-like graphics, and relatively low-speed computer systems that were used have been replaced by a growing VR consumer market, pocket computing platforms, and exponential growth in processing speeds. As advancements continue, the growth and usefulness of VR in healthcare continues to expand. When there are advances in technology, it provides an opportunity for the healthcare world to benefit from these advances. VR is an engaging form of gaming, but it can also be used as an effective form of therapy. The use of VR in healthcare has benefits that go far beyond the joy of the player experience when using them. For example, an elderly individual suffering from a stroke to a child with autism. VR is regarded as a beneficial intervention strategy in a variety of medical settings. Although not all medical settings use VR, there are specific diagnoses that incorporate virtual reality interventions more than others. Some of these diagnoses include stroke, spinal cord injury, cancer, dementia, burns, cerebral palsy, and various aspects of mental health. Most studies have found positive outcomes in using VR. Some used VR as a way to lift spirits of their patients, while others to distract them from pain, and many as a type of therapeutic intervention. Here are a few of the challenges we identified early on in our research process. First, the applications were extremely broad and difficult to determine the best way to use VR. Currently, there is limited research for the use of VR specifically related to the OT profession. We also found there were inconsistencies with the definition of VR throughout these studies, which added to the confusion of how VR is currently being used.
Let's briefly discuss the technology definitions that we came across when we were conducting our research. To start, we are going to define gaming. You can think of this as a large umbrella term that encompasses many forms of technology. Gaming is defined as an electronic game in which players control images on a video screen. Virtual reality, or VR, takes it a step further and is defined by the use of interactive simulations created with computer hardware and software to present users of opportunities to engage in environments that appear and feel similar to real-world objects and events. We as a group determined to use the word immersive VR within our defense. Immersive VR is a virtual reality setup that includes a head-mounted display, including but not limited to a screen, speakers, and gyroscopic sensors. This setup currently provides the highest level of immersive experience. It was our personal experience utilizing immersive VR on the PlayStation 4 that we found head-mounted systems to be more demanding and immersive in general, causing a greater impact on a variety of human systems. This immersive experience is provided through the use of various equipment. Research articles reviewed utilized a variety of VR setups from multiple different brands including Sony, Oculus Rift, Google, Samsung, and HTC, for example. Technology is truly amazing and continually improving. Pictured above is an example of what a complete immersive VR experience can consist of. Equipment includes a VR headset with embedded screen, speakers, and gyroscopic sensors, a TV set for observers to experience what the participant is viewing, controllers with haptic feedback, and a PlayStation 4 acting as the brain of the system. Within our time conducting research, both Sony PlayStation as well as Oculus Rift have both released new and more powerful versions of their equipment. VR has solidified its stance not only as a consumer gaming system, but also as a powerful tool in healthcare. Next, we developed our research question to narrow our focus to immersive VR, but broadened it to include all healthcare disciplines in order to gain a better understanding of existing uses. Therefore, our research question is, what are the existing uses of immersive virtual reality as a therapeutic intervention across various healthcare disciplines? Next, we're going to discuss the various methods proposed for our research. Now I know what you're thinking, what the heck is a mapping review? Mapping reviews utilize a visual synthesis of the data to review questions. It categorizes information according to theoretical perspective, population group, or the setting within which studies were undertaken. As a result of developing an organized and coherent map, researchers can determine whether to undertake the in-depth review and synthesis on all of the studies or just a subset. Furthermore, researchers can determine whether there are enough relevant resources to complete a systematic review. Since VR is so new to healthcare, we weren't sure how much information was actually published, and we wanted to synthesize our data in an organized manner and identify gaps in published literature, so a mapping review was determined to be the best fit for our research topic. For example, the figure to the right demonstrates a mapping review that was completed for a topic in education. The study had found 30 relevant articles that contain information for curriculum and conceptual and descriptive papers, but researchers only found one relevant article that was about assessments and provided qualitative data. This may provide an idea for future research. Perhaps you would want to do your own qualitative research regarding assessments, or you may want to do a systematic study in an area where they found much more research. Pictured above is the overall mapping review process that we followed to complete our research. We started by defining our research question. We completed a search using multiple databases. We screened and determined relevant papers. We defined keywords and we looked for common themes. And finally, we completed the map.
PRISMA, which stands for Preferred Reporting Items for Systematic Reviews and Meta-Analyses, was used to further guide us through our mapping review process. While PRISMA in its entirety is a framework for systematic reviews and meta-analyses, an extension was developed for scoping reviews, which closely relates to the mapping review criteria. Looking at the flowchart presented, you will see how our process followed the 4 stages of identification, screening, eligibility, and studies included. However, we bypassed the eligibility of reviewing full-text articles. Sufficient data was collected from the abstract and title only, while utilizing our inclusion and exclusion criteria.
Before we started our research, we decided on 4 inclusion criteria for the citations that we review. We wanted them to focus on immersive virtual reality, which includes the use of some sort of head-mounted display, have a therapeutic intervention, occur in a healthcare setting, and be written in the English language so that we are able to read them. Since we wanted to exclusively focus on immersive virtual reality, any articles that were about augmented reality, augmented virtuality, and non-immersive virtual reality were excluded from our mapping review.
Databases. The databases we collected from were PubMed, CINAHL Complete, PsycInfo, Web of Science Core Collection, OT Seeker, and Applied Science and Technology Source Unlimited. We agreed that these databases were broad enough to cover the whole scope of VR application. For example, PubMed is healthcare-based, and Applied Science and Web of Science covers more of the computer science application of VR. And then OT Seeker would help us collect anything occupational therapy related that's out there in regards to virtual reality. Search strategy. An example of the search strategy used for PubMed is on your screen right now. We used various word versions of virtual reality. For example, exposure therapy, head-mounted display, Oculus Rift, and virtual reality goggles. By doing this, it provided us with access to any citation that may have discussed the use of virtual reality, but used different verbiage. The TW in brackets following each of the phrases stands for text word. It tells PubMed to look for the search term in the title, the abstract, the subject heading, and the author supplied keywords. It will not search the full text. This helps eliminate some of the citations that are not relevant to our research question.
Search results were stored in Zotero, transferred into an Excel spreadsheet, and duplicate articles were deleted. We then reviewed the articles against inclusion and exclusion criteria to determine eligibility for mapping review. Research members were paired into teams of 2 for a total of 5 teams. Each team screened a specific batch of citations, reviewing the title and abstract for inclusion and exclusion criteria. When there was a discrepancy between the 2 paired researchers, a third researcher reviewed the article's title and abstract for inclusion and exclusion criteria and ultimately determined the final article eligibility. Once relevant articles were identified and duplicates were removed, researchers categorized articles by population and setting. Since there are 5 of us, we created 5 reviewer teams so that we could evenly split up the articles that we review. Each team reviewed a predetermined batch of articles, which are listed on the right side of this table. That third team member was also predetermined and listed on the right-hand side as third reviewer.
A map in the making. The data collected from the previous search strategy was sorted using Microsoft Excel. The sort column feature was used to group settings, then to sort each group of settings by populations. Generalized categories were developed for both populations and settings based on common themes. Articles that did not match any of the common themes were placed under the mixed category for population and the general category for settings. Microsoft Excel was then used to create a bubble map and a pie chart as a visual.
This table allows you to look a little closer at how we sorted our articles based on population and divided them into categories. As we discussed a moment ago, we looked for common themes for both the setting and population axes. For the population, we identified the following categories: behavioral, neurological, pain, physical rehab, psychological, and vision. We then sorted our articles based on these categories. So, for example, articles about stroke were placed under neurological, and articles about post-traumatic stress disorder were placed under psychological. Once we had sorted all of the articles that matched one of the categories, we had 30 articles remaining that did not fit. So as a research team, we decided it was necessary to create a mixed category, placing the remaining miscellaneous populations. For example, articles about memory, while many memory limitations are due to neurological conditions, they could also be a result of a visual deficit. And because the title and abstract did not specify, this article was then placed in our mixed category.
And now let's dive into our results. The database search found 5,376 article citations. This research team removed a total of 1,600 duplicate articles, which left 3,776 articles for further review. As mentioned previously, in teams of 2, we reviewed the title and abstract of all 3,776 articles to see if they fit our inclusion and exclusion criteria. 408 articles met our criteria, and they were used to create our visual bubble maps and pie charts. And here is our visual bubble chart. First, I want to explain how to interpret this. We have settings on our x-axis and the population categories on the y-axis. Where these lines intersect, you may find a bubble. The number that you see in each bubble indicates the number of articles that mention the intersecting setting and population in their title or abstract. The size of the bubble increases as the number of articles increase. And if there is not a bubble at that intersecting point, that means we did not find any articles for that cross of population and setting. For example, you can see that we found 6 articles that mentioned an inpatient setting and a neuro population. We found 9 articles that mentioned an outpatient setting and pain. And we found 0 articles that mentioned outpatient settings and vision. You may also notice we have a lot of bubbles listed for the general and unknown settings on the x-axis. If it was placed in the unknown setting, that means that simply the setting was not mentioned explicitly in the title or abstract. If it was placed in a general setting, that could mean that perhaps it was a systematic review for a given population, but with a general application, or maybe a variety of settings were used in the review. Or it could have just mentioned healthcare in a general sense. To provide another visual of the distribution of articles, we thought it'd be nice to include something that everyone's familiar with: pie charts. This pie chart demonstrates the distribution of therapeutic uses of virtual reality by population. So you can see that the majority of the articles found were about physical rehabilitation, neurological, and psychological populations. I was quite surprised to see that 16% of our articles were about pain. This was an application that I had not considered prior to this study. This pie chart demonstrates the distribution of therapeutic uses of virtual reality by setting. To just name a few, we have 3% in community, 5% in inpatient, and 7% in pediatrics. As you can see, the majority of articles had an unknown setting at 41%. The implications of this we will be discussing in the next section.
Next, we're going to discuss the findings of our research. This research process identified gaps within current literature and provided researchers a greater understanding of how immersive VR is currently used therapeutically. Although the researchers set out to clearly define the population and settings for the study, it is important to note that many articles span multiple settings and a variety of populations. The following was noted. First, a large number of research articles did not indicate their practice setting within the title or abstract. Why is this important, you may ask? When searching for evidence-based research, it is helpful to review the abstract and title to determine its usefulness or relevancy for intervention planning. articles lacking this information impacts the practitioner's efficiency and productivity for developing innovative and client-centered treatment plans. Next, we found that many articles spanned multiple settings and a variety of populations. While looking at the data through an OT lens, it initially appeared that this was a positive aspect, but in actuality, for research purposes, this made sorting extremely difficult. Despite this fact, identifying that the research does span across multiple settings and populations showcases the malleability of VR as an intervention and the wide scope of practice it can be implemented with. Next, we found that a large percentage of articles fell into the mixed and general categories for population and setting. For example, the mixed category comprised 7% of the population total, and a whopping 20% of the settings fell into the general category. This indicates that much of the current immersive VR research is for general application with non-specific populations. Also, with a large percentage of articles falling into mixed population category and general settings category, the data suggests that much of the immersive VR research has not been assessed on patients with a specific diagnosis in a particular clinical practice area. This should encourage future researchers to begin utilizing immersive VR with more specific settings and populations. Next, with some settings such as inpatient skilled nursing facilities, there is little variation in population. For example, the typical age range in a skilled nursing facility skews towards older adults. It's interesting that only a small percentage of articles were related to the older adult population, which came out to be 2%, despite the large number of articles that were related to older adult dysfunctions such as gait, balance, vision, and stroke. The older adult population may not be familiar or comfortable with this form of technology, lacking the client-centered approach clinicians strive for. However, it may also be the practitioner's unfamiliarity with the use of immersive VR as a therapeutic intervention, causing cultural or age biases. And finally, the use of immersive VR may vary according to the setting. So while reviewing the data, we found that VR is currently being used in a wide variety of ways within each specific setting. For example, if you take a look at the pediatric population, our research shows that VR is not only being used for physical rehabilitation, but it's also being used to treat pain, psychological, and neurological issues also.
So now we need to address some of the limitations that we came across. The first limitation we noticed with the process of our research was during the data collection process. As a team, we decided to use specific databases that we felt targeted our research topic. However, the results may have looked differently if we had chosen different databases. Also, one of the components for our inclusion criteria was that the article focused on the use of immersive virtual reality as a therapeutic intervention. This is where biases may have played a role because as individuals, we have different interpretations of the term therapeutic. For example, with the article discussing erectile dysfunction, one reviewer may have considered VR a therapeutic tool, while another reviewer considered it as a medical procedure. Being limited to only reviewing the titles and abstracts of each article contributed to the lack of detailed information that we needed to reduce the opportunity of bias.
After completing this research, we identified 4 implications for OT practice. This research identifies areas of OT practice and populations in which therapeutic use of immersive VR has been studied. It also provides future OT researchers an opportunity to fill gaps in knowledge as it relates to the use of immersive VR as a therapeutic approach. OTs who are looking for more therapeutic interventions can use this research to help broaden their understanding of the use of VR therapeutically. Additionally, VR gaming is a leisure activity for some. This research demonstrates the use of a leisure occupation to address alternative occupational engagement in other contexts or virtual environments. During our literature review, we also discovered that insurance companies are beginning to recognize VR as a cost-effective treatment option. This may lead to an increase in the number of OTs who seek out therapeutic applications of VR. We determined that this research connects to a specific OT theory and frame of reference, which are the ecology of human performance, EHP, and sensory integration frame of reference. The EHP model looks at a person's occupational performance, that is, what a person does each day and how well, in relation to the context in which the activities occur. An OT can use these therapeutic uses of VR along with an EHP intervention to address an occupational performance issue with their patient. EHP has 5 intervention approaches. The first intervention approach is Establish and Restore, which is aimed at improving abilities and function. An example includes using VR to help restore an individual's balance. The second intervention approach is Adapt and Modify the context or the demands of the task. An example includes using VR to adapt and modify a task by modifying and adapting the environment. The third intervention approach is Alter, altering the environment to find the ultimate context. VR is by definition altering an individual's environment with hope to promote occupational performance. The fourth intervention approach is Prevent or Anticipate problems. An example includes using VR to help prevent psychological symptoms of an individual with PTSD by the use of exposure. The fifth intervention approach is Create. For example, create opportunities for an improved performance. VR has the potential to create unlimited opportunities for improved performance. Our main focus reviewing associated literature was to see how various immersive VR interventions impact a client's ability to establish, restore, alter, adapt, prevent, or create situations where function can be present and optimal in an individualized environment. Now moving on to our frame of reference, which is sensory integration. Sensory integration is the ability for a person to receive and process information from one sensory systems, including tactile, which is touch, visual, which is sight, auditory, which is hearing, proprioceptive, which is body position, and vestibular, which is balance. Sensory integration treatment is a continuous process based on plasticity occurring in the central nervous system. Nervous system function is enhanced when tactile, vestibular, and proprioceptive systems are incorporated, ultimately increasing sensory function. Since VR targets proprioceptive, vestibular, and visual senses, OTs can use VR as a valid intervention tool to maximize occupational performance.
Conclusion. The healthcare industry demands innovation and seeks out evidence-based interventions to provide the best possible outcomes for its patients. As future therapists, we know this is pertinent and will continue to uphold this expectation as we go on to practice as occupational therapists. This mapping review shows us the wide range of immersive VR research that is currently out there. This will assist us along with other healthcare providers in discovering new and innovative intervention techniques that are supported by evidence-based research. Since this research identified gaps in published literature, it gives future researchers a foundation for systematic reviews or further research studies. As technology advances, we may see a growing number of immersive VR applications in the healthcare setting, and this research is just a glimpse of the potential that VR holds in the therapeutic setting. Any questions? At this time, we will now go live and open up the remainder of this presentation for questions. Just give us a second to transition, and Melissa, Jamie, Josh, Veronica, and myself will be right with you.